Students here today presenting to you about lung cancer for our chronic care presentation, so enjoy. So a brief overview of lung cancer. Lung cancer occurs when abnormal cells in the lungs grow in an uncontrolled way. It often spreads to other parts of the body before the cancer can be detected in the lungs. Lung cancer is the leading cause of cancer death and the 5th most common in Australia. Divided into two separate parts, non-small cell lung cancer is the most common with 80% of cases. Developing in the larger airways of the lungs, commonly diagnosed in current or former smokers, also the most common in non-smokers. Small cell lung cancer usually begins in the middle of the lungs and spreads more quickly than non-small cell lung cancer. It occurs in between 15 and 20%. It accounts for between 15 and 20% of lung cancers. So signs and symptoms, presence of risk factors, smoking or exposure to smoking, a cough that doesn't go away, new or persistent cough, especially in current or former smokers, chest, shoulder and back pain. So the tumours within the chest are known to invade the space of the pleura or the cell wall. Shortness of breath, difficulty breathing, which is in the majority of patients. Weight loss, bloody sputum in around 25% of patients, and recurring infections such as pneumonia and bronchitis. So looking at the two x-rays, the one on the right is a healthy normal lung. On the left we can see a silhouette of lungs, in the lungs of clumps of white to signify this lung has cancer. Now changing over to my colleague on prevalence of lung cancer.
Lung cancer had an estimated 12,434 new cases in 2017, which was, as a percentage, was 9.3% of all cancers. This causing it to be within the top 6 types of cancer affecting Australians. The following year, in 2018, almost 12,800 new cases arose, showing a rising increase in numbers each year. Of those new cases, 72% did not survive in 2018 alone. It is said that roughly 1 in 17 people within Australia will be diagnosed with lung cancer by the time they reach their 85th birthday, with a ratio of 1 in 14 males and a 1 in 21 females. The reason as to why men have a smaller ratio compared to women is that they tend to smoke and drink a lot more, thus increasing the risk of being diagnosed with lung cancer. 15,500 cases of cancer are caused by smoking tobacco, and within Tasmania alone, 10% of cancers is lung cancer stemming from smoking. As shown in the diagram, diagnosis of lung cancer peaks at the age of 80 to 84 years of age, especially in males. This, I believe, is due to the fact that smoking many years ago was not seen to negatively impact your health, whereas now the stigma towards smoking has shifted completely, as we are now better educated when it comes to smoking and the serious detriments it has on your health, specifically to lung cancer. Those who have smoked many years ago are now affected due to both the build-up of smoking over time and the lack of information around smoking. Now my colleague Phoebe will take over to talk to you about the multidisciplinary team.
Hello. So what do we mean by a multidisciplinary team? A team of health professionals who have the responsibility of coordinating the patient's care effectively. They reflect both clinical and psychosocial aspects of care. A team who play a role in certain aspects of care, including referral, diagnosis, treatment, prevention, coordination, continuity of care, education, and support. They assess the goals, benefits, and risks for each patient and recommend treatment options. The multidisciplinary team is made up of psychologists, nurses, exercise physiologists, occupational therapists, physiotherapists, social worker, speech therapists, and just to name a few. The action plan of the multidisciplinary team. Step 1. Patients visit local general practitioner. They receive a referral for a specialist if presenting lung cancer symptoms. Step 2. Specialists start diagnosing tests. such as chest x-ray, CT scan, lung biopsy, sputum tests, this can take up to roughly 2 weeks to get the diagnosis and the stage of the lung cancer. There's no form of population screening that has been shown to improve lung cancer outcomes. Step 3. Once diagnosis of lung cancer is positive, then treatment and preventative health by the MDT is started. For example, physiotherapy, doctor talks to patient about quitting smoking. Prevention, tobacco and smoking. Smokers and second-hand smokers are at a high risk. We offer advice on quitting smoking, such as the QUIT program and nicotine therapy replacement. Second, asbestosis, found in fireproof insulation in buildings. When inhaled, they can irritate the lungs. It is good to use protective breathing equipment. Number 3, radon, invisible odourless gas naturally released by some soils and rocks. Number 4 is other substances. Gases or chemicals at work or in the environment can increase a person's risk of developing lung cancer. Treatment planning, discussed by a multidisciplinary team before treatment begins. Discuss a time frame for diagnosis and treatment so the patient is aware. Provide appropriate information or refer to support services as required, such as the Quit Smoking program or Cancer Council. Types of treatment. Early stage is usually surgery, including removal of nearby lymph nodes. This can also include chemotherapy or radiation, but they can also be their own treatment as well. Targeted therapy, medicines specifically attack cancer cells, and immunotherapy, also it does medicines that boost your immune system to attack cancer cells. Advanced lung cancer, it will go to palliative chemotherapy and or palliative radiation therapy, may be offered depending on symptoms. Now that's the end of the multidisciplinary team, so now I'll be passing you on to Evie, who will be talking about the government and how they are working towards lung cancer. That's right, we can just cut it out.
Yeah, we'll cut this out. So I'm going to be talking about government strategies to manage lung cancer. Studies do suggest that people who smoke are 10 times more likely to develop lung cancer. And with these statistics in mind, a large aspect of lung cancer management is directed through tobacco control and education. So the first thing the government does is put health warnings on cigarette packets. By law, all tobacco products are required to display a health warning. Health warnings provide strong and powerful messages to the health implications of tobacco consumption. Since the 1st of December 2012, all retail packaging of tobacco products supplied in Australia must display the current health warnings. These feature things like graphic pictures, explanatory messages, and they're rotated health messages to provide customers with a wide range of information. The second thing is tobacco taxation. 12.5% is paid on tax on tobacco products since the 1st of September 2014. And it's said that increasing tobacco prices through taxation is one of the most effective measures that governments can take to reduce premature death and disease due to smoking, according to the Department of Health in 2018. It's believed that increasing tax has led to a lesser consumption of the product and a greater desire for customers to try and quit. Number 3 is free information on the internet. There's an abundance of free information available on the internet about how to reduce the risks of lung cancer. This information addresses the consumption of tobacco as well as other lifestyle changes individuals can make to reduce their risk of developing the disease. An example is Health Direct, which is an Australian government-funded service that provides free government-approved information. It also offers links to other relevant resources and references where the information has come from. The fourth incentive is cancer education sessions. The Cancer Council offers education sessions on smoking and lung cancer and smoking cessation. These workshops are free to community groups and schools and require a small fee for secondary, tertiary and workplace sessions. The sessions are highly informative on the products in tobacco and their effect on the body, informative of signs and symptoms of lung disease and lung cancer. They provide information on how to manage or prevent signs and symptoms and offer tips and references to help smokers quit their habits. You can book sessions via the Cancer Council by calling their helpline. And
I hope you gained some information.
So thank you for watching our presentation. I hope you gathered some valuable information. Please look out for any signs or symptoms of lung cancer and speak to your doctor if you think you might need to.
That's done. Alrighty. Alright, that's
Do they have a class in here?
No, they've got a meeting.
Oh, okay.
Whoops.
Alright, so do you know how to cut and
Wait.
cut and stop?
Sure, I'll try. Figure it out.